And away from the political arena, clinical officers have vowed down their tools come Monday should the government fail to comprehensively address their demands. Through their union, the clinicians say their safety remains non-negotiable and that the government must demonstrate its commitment to creating a safe working environment for all healthcare workers in the country. Now, the demands coming a day after Labour Cabinet Secretary Simon Chelugui appealed to medics to suspend the planned strike and allow for talks.
You cannot negotiate on matters of life and death.
Services in all public health facilities risk grinding to a halt come Monday as negotiations between the government and healthcare workers continue to come up empty.
They have invited us for a tripartite meeting, and they are doing the same thing they have done over the past 2 occasions where we have had to go before them on mediation or arbitration. They are telling us we have to segregate the issues and then we let them handle. And that is the same thing they said in May when we had our first strike that we suspended, and then in August when we actually suspended the second strike.
On Friday, Kenya Union of Clinical Officers and the Kenya Union of Nurses said there will be no turning back on their resolve unless the government meets its end of the bargain. The healthcare workers allege that there has been no attempt by the Ministry of Health and the county governments to address their grievances since the announcement of the strike notice on 23rd of November.
We gave our demand letter on 16th of November so that we could be able to sit down and agree on how to resolve the issues that have been standing. But the government did not heed to our call. 7 days later, we went and issued a strike notice. Up to date, we have not had any engagement with the government, more specifically the Ministry of Health and the county government under the COG. And this is to mean that they do not prioritize issues of health in whichever manner.
On Wednesday, Labour Cabinet Secretary Simon Chelugui said the government had ordered KEMSA to release all PPEs and urged county government to expedite the implementation of the comprehensive medical cover through NHIF, and that the government had also established a multi-agency committee to look into the health workers' grievances.
Those PPEs are not there. The CS Health ordered on television, I think about a month and a half ago. They were never released. They have not been released. So we will only respond to tangible things. Whatever has reached the dispensary, the health center, and the other hospitals, that is what we know. The other rhetoric remains rhetoric, and we will not be persuaded using rhetoric.
Chelugui's appeal coming even as the healthcare worker said that a total of 763 clinical officers in public and private hospitals have been infected by COVID-19, 9 of whom have already succumbed to the disease.